Could my joint pain and body aches be caused by my hormone or a thyroid issue? This question usually comes after months, sometimes years of brushing it off. Women will say, I feel stiff when I wake up. My hands ache in the morning. My knees feel older than the rest of me. I stretch and it really doesn't change. I feel inflamed. I feel creaky. I feel like I've aged overnight. And then here comes the worry. Is this arthritis? Is this just aging? Am I breaking down? Let's slow this down and think about it. Hormones are deeply connected to inflammation. Estrogen is not just a reproductive hormone. It's anti-inflammatory and it supports joint lubrication. It supports collagen production and it often influences pain perception. When estrogen begins fluctuating in perimenopause and as it begins to decline steadily in menopause, inflammation gets higher. That can show up as morning stiffness, aches that weren't there before, increased sensitivity, muscle soreness that lingers. Now, layer the thyroid on top of that. Hi, I'm Dr. Tramp. I'm a licensed medical doctor and functional medicine practitioner. I focus on helping women suffering with tough and challenging thyroid and hormone issues. My approach to complicated thyroid and hormone issues is very different from others. In my practice, I utilize the very best of traditional medicine along with the very best of functional medicine to help my patients regain their health and get symptoms under control. Could my joint pain and body aches be caused by my hormone or a thyroid issue? Thyroid hormones regulate the metabolism at the cellular level, including in our connective tissue. When thyroid signaling is low or inconsistent, tissue repair slows, fluid distribution changes, and women can feel puffy, stiff, and heavy. And autoimmune thyroid disease like Hashimoto's increases systemic inflammation. If the immune system is activated against the thyroid, that inflammatory signal does not stay neatly contained. It circulates. And inflammation doesn't just live in one organ, it affects your joints and your skin and your mood and your energy. And then we add in stress physiology. Chronic cortisol really changes your pain sensitivity. So it can amplify how intense discomfort feels. It can impair your recovery. So the women who used to bounce back from a workout now feel sore for days. And here's where it becomes more emotionally heavy because women say, I don't feel like my body is mine anymore. I don't trust my body. I feel fragile. But fragility is not the same as dysfunction. Inflammation is communication. Joint pain in midlife is often a signal that your hormones are off and possibly a signal that your immune system needs work. It's not always about structural damage and it's not always irreversible. When we stabilize our stress physiology, when we support our estrogen, our progesterone, our thyroid, when we calm down your immune system, when we help your gut, when we correct our nutrient deficiencies, most women notice that their joints feel way less inflamed, less swollen, less angry, more mobile. It's not magic, but we remove the inflammatory noise. You're not breaking down. This isn't permanent for many people, and we can help you on this journey. Visit the link you see with this video to schedule a consultation with our office now. We'd love to explore how we can help you and any unresolved hormonal issues you may be dealing with.